What is fever? Fever, also referred to as pyrexia, is a higher than normal body temperature of 98 to 100 degrees Fahrenheit. Temperature 102 degrees Fahrenheit and above should be treated. A fever is a symptom, not a disease. When an infection occurs, the immune system will launch an attack to try to remove the cause. A high body temperature is a normal part of this reaction. A fever will usually resolve on its own. However, if body temperature rises too high, it may be a symptom of a severe infection that needs medical treatment. Taking a temperature. To take a temperature, you can choose from several types of thermometers, including oral, rectal, ear, tympanic, and forehead, temporal artery thermometers. Oral and rectal thermometers generally provide the most accurate measurement of core body temperature. In infants, doctors generally recommend taking a temperature with a rectal thermometer. Causes. Fever or elevated body temperature might be caused by virus, bacteria, and other microorganisms, birds, animals, and insects. Heat exhaustion. Post-medications or drugs. Post-vaccination or immunization. Overdressing. Infants, especially newborns, may get fevers if they're overbundled or in a hot environment because they don't regulate their body temperature as well as older kids. Sometimes the cause of a fever can't be identified. If you have a fever for more than 3 weeks and your doctor isn't able to find the cause after extensive evaluation, the diagnosis may be fever of unknown origin. Types of fever. Typhoid fever, rat bite fever, cat scratch fever, chikungunya fever, Zika virus fever, dengue fever, scarlet fever, tick bite fever, parrot fever, trench fever, mosquito-borne viral fever, sandfly fever, Quinton fever, Wolenian fever, Kew garden fever, enteroviral exanthematous fever, West Nile fever, Oniong-Niong fever, Venezuelan equine fever, Rift Valley fever, Orapauchi fever, Papatassi fever. Oroya fever, Pontiac fever, Brazilian purpuric fever, Laos-borne relapsing fever, Tick-borne relapsing fever, Tsutsugamushi fever, Rocky Mountain spotted fever, Ross River fever, Haverhill fever, Sao Paulo fever, Boutonniere fever, Marseilles fever, typhus fever, spotted fever, Q fever, 9 Mile fever, quadrilateral fever, Colorado tick fever, arboviral fever, sylvatic yellow fever, jungle yellow fever, urban yellow fever, Lassa fever. Arthropod-borne viral fever, hemorrhagic fever, Songo fever, phlebotomist fever, drug-induced fever, post-procedural fever, post-vaccination fever, post-immunization fever, post-blood transfusion fever, and so many. Complications. A fever can be acute, if it lasts for under 7 days. Subacute, if it lasts for up to 14 days. Chronic or persistent, if it lasts for over 14 days. Fevers that exist for days or weeks with no explanation are called fevers of unknown origin. Diagnosis. A doctor can diagnose a fever by checking the person's body temperature, but they will also need to diagnose the reason for the fever. To do so, they will examine the individual and ask them about any other symptoms and their medical history. To confirm a diagnosis, the doctor may recommend a blood test, a urine test, imaging tests. Treatment. The treatment will depend on the cause of the fever. Acetaminophen, Tylenol, can also reduce a fever. Aspirin can help, but it is not suitable for children, and it may not be suitable for people who take blood thinners. If the fever is due to a bacterial infection, doctor may prescribe an antibiotic. If it stems from a viral infection, the doctor may recommend using NSAIDs to relieve the symptoms. Antibiotics will not stop a virus. A doctor will not prescribe them for a viral infection. Fevers generally go away within a few days. A number of over-the-counter medications lower a fever, but sometimes it's better left untreated. Fever seems to play a key role in helping your body fight off a number of infections. A mild fever is part of the immune system's response to bacteria, viruses, and other pathogens. It helps the body fight off infection. Prevention. Wash your hands often and teach your children to do the same, especially before eating, after using the toilet, after spending time in a crowd or around someone who's sick, after petting animals, and during travel on public transportation. Try to avoid touching your nose, mouth, or eyes, as these are the main ways that viruses and bacteria can enter your body and cause infection.